Ruth Katz. I'm the Executive Director of the Aspen Program in Health, Medicine, and Society, and I'm delighted to be here to welcome you and to introduce our moderator for the panel this afternoon, or this morning, I should say. Courtney Martin, right there, sort of in the middle, is Editor Emeritus at feministing.com. She is the founding director of Solutions Journalism Network, and she's a partner at Valenti Martin Media. She's also the author of 5 books or so. Her work has appeared in numerous publications, including the New York Times, the Washington Post, with which I'm sure you're familiar. She's the recipient of the Eli Wiesel Prize in Ethics, and I'm very proud to say that she is a former scholar with us here at the Aspen Institute. So, Courtney, thank you very much, and
That's right.
she'll introduce our panel. Thank you all for being here.
Thanks so much, Ruth. And thank you to all of you for being here. I know you have a great diversity of choices at this particular time slot, because I was jealous of all the other conversations going on. So we appreciate having you here, and we really want to create a discussion. So be thinking about your questions, your complications, your pushback. We're hoping to have a spirited discussion, and one that is truly fresh, because we think women's health is an issue that gets discussed so often, and unfortunately for many of us, it feels like the same kinds of questions get recycled over and over. So our aim as a crew is really to create a truly fresh conversation, and we need you in order to do that as well. I'm joined by people that I feel so honored to be sitting next to. I'm going to brag about them briefly, and then I really want you to just hear their wisdom. Sisonke, sitting right to my right here, Msimang, is a writer and activist who advocates for the better use of money and power in Africa. I love that. She's a senior program director in charge of policy development, advocacy, and communications for Sisonke Gender Institute, not named after her, she clarified yesterday. Prior to that, she was the Southern Africa head of the Open Society Foundations, responsible for growing the portfolio of organizations working on democracy, governance, and extractive industries. She is a World Economic Forum Young Global Leader, a Yale World Fellow, and an Aspen New Voices Fellow. And having gotten to know her a little bit through my own involvement in the Aspen New Voices Fellowship Program, I can tell you we are so lucky to have her here with us today. She's a columnist. She's just constantly reflecting in both the most beautiful prose you can imagine, but also with such a courage and sort of a bravery of heart that I think is so needed in our sort of public conversation. So she's bringing that to us today. Next to her is another New Voices Fellow who I've had the pleasure to befriend over the last couple of years. Otai is a senior program advisor for JPEGO and an Aspen Institute Fellow. It doesn't say here, but it's connected to Johns Hopkins University, right? Otai is currently working with various partners on programs and systems that increase access to family planning and critical health services to women and children. A product of the slums herself, she's witnessed the difference family planning makes in communities with no quality government services. Well, hopefully heard her secret technology that she announced yesterday, the opening session. Otai has spoken at the London Summit on Family Planning in 2012 and at the United Nations in 2014. She has contributed to op-eds in the New York Times, Huffington Post, and on the Half the Sky movement blog. And Jane speaks so beautifully. You know, there's a lot of very high-level conversation at times about these issues sort of at the policy level, which Jane can totally get down on. But the thing I love hearing her talk about is her work in rooms with girls, with women, having conversations in groups, and how, you know, sometimes it's the oldest thing in the world, which is just conversations between people who respect one another and see each other's potential, that actually shifts things in massive ways. So I hope that Jane can speak to some of that today. And then a new friend of mine sitting here to the left, Betty King, is a former U.S. ambassador to the United Nations in Geneva. She previously served as a U.S. representative to the United Nations Economic and Social Council under Presidents Bill Clinton and George W. Bush. And she was the principal American negotiator on the Millennium Development Goals. I'll stop there because we could literally spend our entire time discussing this woman's incredible history and incredible career. We just feel so lucky to have you here, Betty. And Betty kind of swooped in at the last minute, so we're especially grateful to you for being willing to do that. We've had a great ongoing conversation prior to being up on this stage, and one of the things that keeps coming up for us over and over is the sort of tension or dynamic between the technical solutions around women's health, so things like guidelines and goals, and what we're sort of thinking of as more of cultural things, the hearts and minds campaigns. So I want to sort of frame our discussion in that regard. So much change has been made in the last 20, 40, 50 years. From clinical trials, including more women, to a great decrease in many places in maternal mortality, infant mortality. We could go on and on, the domestic violence movement. There's been so much progress. But as we all know, this is called the unfinished revolution for a reason. There has also been a lot of stalling. There has been a lot of resistance. There has been a lot of pushback. And there are a lot of places where the women sitting up here are particularly frustrated. So we're gonna look at the solutions, because I'm a solutions-oriented thinker, but we're also gonna look at the places where we're really frustrated and try to have a very real conversation about that frustration. So put this in your mind: the guidelines and the goals, right? The stuff on paper, the official work, the policy work, the high-level work, and the hearts and minds. It's not an either-or, right? It's an and both. But we want to explore those two realms and kind of look at what's worked and what hasn't. And I thought the best kickoff for that would actually be throwing it to you, Betty. You've been involved in such a intimate way with the Millennium Development Goals, which are obviously, could be a framing for this entire conversation. Tell us a little bit about that work and about your frustration that you voiced yesterday with where that work is going.
Well, thank you. Yes, I was the principal negotiation, not for the United States, but for the developed countries, which, as you know, are fewer in number in the UN than the developing countries. And that was a real battle, because we were obviously coming to it at different points of view. We, of course, had to give a lot in terms of concessions to, on the economic front, that other countries wanted. But I want us to focus on 4 and 5, because this is what we come to talk about: women. And I find it a real disappointment, a tragedy actually, that we had these 8 goals. The first time that anything that was done in the UN really became talked about outside, because most people think what we do in the UN is not relevant, and I sometimes agree. But those 8 goals, to my astonishment, everywhere I go, people talk Millennium Development Goals, MDGs, MDGs, MDGs. So here we had this golden opportunity to show the world, what the work of the UN can do. And the 2, 4, and 5 that pertain to women are the only 2 that have not achieved the potential that we had described 10 years ago. So in this year of the anniversary, we obviously are looking at why these 2 were not as successful as the others. And if you use that as a prism, it sort of gives us an insight into all the conversations we have had about why we've had this inequality. Since I'm the old person on this panel, I would recall my first encounter with Bella Abzug, as she had that march down Fifth Avenue before some of you were born. And
1970,
so that was the big thing for us in the United States. And I was surprised that when I traveled abroad, how much both men and women thought that this was some sort of an American phenomenon, that we were trying to impose these American values on women abroad, on societies abroad. Thankfully, that has now changed, and so we have women from around the world understanding why what Bella did that day was sort of a good lead for us. But we have now now that we've had more of these developing countries getting involved and all that, we have now come to the very difficult part of it, and that is the deeply ingrained cultural attitudes in a lot of countries about women, what role they should play in society, what role they should play in their families, and certainly their relationship vis-a-vis their husbands or their partners. Right. And until we can resolve some of those issues, I think we're going to be having this discussion ad nauseum. Mm-hmm. And I like to look at, I don't like it for a pleasant reason. When I visited Africa during the height of the AIDS crisis, I went there for a health foundation. I was astonished that how many women in the course of their domestic work, i.e. fetching water or the many things they have to do outside of the home, how those chores were the reasons they contracted AIDS. Because they were raped between their house and wherever they went for the water, or whether they went to gather wood for their meal. And I think that then gave us all a rude awakening, that we were not just talking here about a health issue. We were talking about a major societal, socioeconomic, traditional values, and all of those things.
I think this is a really good jump off to talk about those intersections, because that feels like one of the ways in which we have made progress in the framing of women's health is more consciousness that it is not in a silo over there. It's a national security issue, it's an economic issue, it's a climate justice issue, right? And I also think it's a great moment to turn to you, Sisonke, about the HIV/AIDS movement, which, you know, Betty was just talking about being sort of radicalized during that 1970 year, and you've talked about being radicalized in South Africa, you know, sort of this post-apartheid generation saying, what's our issue? And that HIV and AIDS, with a feminist lens, became central to your life. Can you talk a little bit about that?
Sure. So I was amazed when I came to the US to study. I went to college here. And one of the things that struck me a lot when I was studying here was how similar the peers that I had in US colleges were to my own peers back home. And it seemed to me that there was a very significant issue both with sexual health and women's reproductive health issues, but that was a fancy way of talking about power. It was a very fancy way of saying that at the root of it, we needed to understand what was going on between women and men that made it so that it was hard to have conversations where a woman could say no, or she could say yes, and not feel shamed by what it is that she was feeling. And so it seemed to me that for my generation, my parents fought against apartheid, and that racial discrimination was their struggle, and that for our generation, it was really going to have to be this issue of HIV, and that we were going to have to think about our government as not just our liberators in South Africa, but as people who we had to hold accountable. And so I think many of you may know about the struggles of the Truth Action Campaign and the kind of fights we had to take on with our government about HIV. But you know, I want to reference this point about rape and HIV, because in many ways for me, my peers, our issue with, so this is not to minimize the impact of gender-based violence and the fact that many women in fact do contract HIV in the context of extremely violent situations where someone attacks them. But actually the reality is most women who contract HIV are doing so in a situation of a long-term partnership where they do not feel confident and comfortable in the relationship to say, actually, this is not going to happen. Or if it is, it's going to happen in the context of using a condom. Or this is how many kids I want, and let's have this conversation. And so the real issue is that it's hard to quantify that stuff. So is the foundation going to give you money for being able to tick how many conversations are able to be had truthfully and meaningfully between women and men? And so I think so while on the one hand there's been a struggle for my generation of young South Africans to look at pills and putting treatment in people's hands, we've also had a real struggle as women around the intangibles, the stuff that's not so easy to quantify.
Right, and really speaking to that institutional power versus personal power. And that personal I mean, we always talk about the institutional level because there's a way you can see it and name it and problematize it. The personal power thing is really hard because as we're talking about, it's about these entrenched cultural experiences, it's about the way we're raised in families, what we witness, you know, in our parents' relationships, all of those things. Absolutely. Jane, will you jump in there because you work with women, you bring them into the room, and you try to build this internal power that we're talking about. How do you see it work? What's successful?
I really liked what you said, that many women contract HIV and AIDS when they're doing their domestic chores. I work in the slums of Nairobi, and I worked on a program for HIV and AIDS at a point up to now, I still work with the women and we talk about those issues. But at that time, it was issues related to sexual violence within the slums of Nairobi. And when I went in to work with them, I thought they really needed family planning to space their children. And the women said, stop. For now, it's not about early pregnancy. It's about sexual violence and HIV and AIDS. We do not get pregnant because we do not know so much about family planning. But many of us get pregnant and actually get HIV and AIDS due to sexual violence that we encounter when we are going to the health facility late in the evening, when we are going to fetch water, when we are going to the shop. It's not safe for us to work in these communities. And so we had now to change the whole program and start talking about sexual violence. And also involve the police, the chief and administration, who will then be able to address issues of sexual violence. Because again, in many of our countries, sexual violence against the woman is blamed for having had it happen to her. Either she was not well dressed, or she was working at the wrong time, or in the wrong place. You know, everything is about, she is to be blamed for having contracted HIV and AIDS and for having been raped. So the police easily dismiss it. So we had to train the police and to really get them to understand this issue and try to help the women who had been raped in the communities.
So I remember long time ago, I'm showing a bit of my age, and we were having a discussion. It was the first time in Southern Africa we brought together a regional meeting. It was about 16, 17 years ago. We're having a regional meeting of young women living with HIV. And we were starting to talk about what does it mean to be an activist as a young woman who got HIV. This was before treatment was rolling out, and so it wasn't the greatest of times. And so we did a lot of sort of life stories, and people talked about themselves. And so in the course of a conversation like that, over 3 or 4 days, you begin to get very personal, and you talk about what's happened, and you talk about how you contracted HIV. And it was really fascinating for me because the initial arc was that I contracted HIV because I was raped. And I think that was a story that women sometimes have to tell because the complexity of contracting HIV in the context of a loving and coercive relationship is very difficult to talk about. So you know, increasingly as a writer, I am very interested in that difficult complexity, that it is both true that sexual violence is a major factor that shapes the structures where we walk, how we walk, when, whom we talk to, all of these many things, and structures how many of us contract HIV. And it is also true that you can be in the context of a loving and coercive relationship, because that is the culture in which we live. White and black women, women in America, and women in Kenya and in South Africa and so on. And so the story began to shift because we created an environment in which it was possible to say both that I contracted HIV and that you are not to blame even if you had sex willingly, and that sometimes it's not clear that that sex was actually willing, and therefore maybe it also was rape at another time, right? So that difficulty, I think, in navigating is part of the unfinished business of women's health, because I think a model that tries to slot us in to a technical fix, this is my big thing, that I'm tired of the MDGs with respect, I'm tired of a development framework that makes us almost robotic and difficult, and it's difficult to understand the complexity of the lives that women live, and that we have to begin or continue to talk about power, about money, about sex, and the things that structure these very complex conversations.
Well, to bring it home, because we do want to talk about the domestic context, one of the books I've written is called The Naked Truth, and it's a biography that I co-authored with a young woman named Marvelyn Brown from Nashville, Tennessee, young African-American woman who contracted HIV/AIDS at 19 years old. And at the time, you know, this is such an interesting sort of domestic global dynamic, thought HIV and AIDS was only in Africa because she had learned, she'd seen like a picture in a health class, but no one had said it's here at home and it's affecting particularly African-American women, et cetera. So she contracts HIV and AIDS, you know, basically decided it was a death sentence, and then slowly emerged, as with so many of these huge challenges in our lives, to basically leverage it to have this amazing, interesting, purposeful life. So she's out in the world doing fascinating work. But the moment that really killed me was she and I were having this conversation once, and she said, you know, in some ways I feel lucky that I got HIV. And I was like, well, why is that? That really took me aback. And she said, because all of my peers, my friends, when I go home to Nashville, got pregnant at the same age that I got HIV. I didn't get pregnant because I was sort of a persona non grata after I got HIV. And I have had a far more interesting, far more broad, in some ways a healthier life than these women friends who got pregnant. And I thought that was so interesting because speaking to this complexity, it's not a narrative you would ever think about, that this sense of that it was actually more opportunity to be infected by that disease than to get pregnant, and that there's sort of the limitations of opportunities of imagination, basically, in that community and of economics and other things had made her actually feel lucky about that. And for me, that also speaks to that complexity domestically, that it's not just a global complexity. We sometimes think all the problems are over there in the developing world. Well, they're right here at home in the U.S. Betty, you were going to jump in, I think. Yeah.
Because we do have that problem, and certainly not as extreme as the example we just heard. But again, if you look at the data, African American women have, in the height of the epidemic, had higher numbers than any other women in America. So one, I'm glad that we are talking about America, because too often we lapse very easily into talking about Africa and other countries, but it is here, and some of the same problems and causes of it. So at least now we can talk more about it, because we have made a lot of progress here in America in terms of reducing the incidence, and certainly in responding to the care issues and so forth. In the African American community, the women feel, a lot of women feel very much like the women you talk to in Africa about the entitlement of African American men when they are with their, whether it's their wives or their girlfriends or what have you. And we have that same problem. So I'm glad that we are making it quite clear, thanks to you, that we're just not talking, because it's very easy for us to sit here and point our fingers at Africa.
Right.
It's right here in our...
And you're speaking to this hearts and mind things again. Jane, I wanted you to chime in about religion, because that's something we had talked about. One thing is, male patriarchal sort of perspective, this kind of toxic masculinity that there's this new narrative around, which I'm personally very excited about. But another one is sort of the religious patriarchy and the influence that's having on the girls that you interact with. Can you talk a little bit about that?
Yes, thinking about religion, and especially in Africa or in Kenya, where I come from, you'll find that the men are the ones who are the religious leaders. They are the bishops, they are the pastors, they are the clergy. It's the men who are actually in those positions. And many times, they do not understand the complexities that a woman goes through. And many times they interpret the Bible or the Quran or any other of these religious books at the disadvantage of the woman. For instance, in issues of family planning, they will get to those areas which discourage women from using family planning, like, go out and multiply and fill the earth. That is something that is easily used. But we've also found that when we engage the religious leaders, when we bring them together, and when we talk to them about the benefits of family planning, and even get those verses that support spacing of children, they've been able to support family planning. And we've been able to use the church compounds. We've been able to talk about family planning in a church setting. And because they are supportive of our family planning, then women within the church have come forward and are using family planning. But until they get to that point where they become champions, where they change their perspective, and where they now see it from a different perspective, there will always be a barrier to some of the advancements of women. But when they are converted, they become champions of women's health, and we are able, for instance, for our family planning campaigns and outreaches, we actually do it in the church or in the mosque compounds. And that has been really a shift, because for a long time, Even when you talk to women who went to the mosque or who went to church about family planning, they would say that our religion forbids us from using contraceptives. But now, after talking to the religious leaders, they are able to talk about spacing, and we don't talk about family planning. When we are talking to religious leaders, we don't not use the word contraceptives or family planning. We use the word healthy spacing and timing of pregnancy. Because then that term really resonates with them. It's a healthy spacing and timing of pregnancy for the benefit of the mother and for the benefit of the baby. So they also use those terms and are currently supporting family planning and are promoting it. And we are using their compounds for family planning. We are using them as champions for family planning, and we are seeing good results.
I love that, the translation and the strategy there. I also, the first time Jane told me this, I was like, will you send me those Bible verses? Like, don't you just want to have that tool with you to be able to use? What Bible verses are you choosing? That's another conversation. Maybe we can send them around.
They've made more progress
Yeah,
than
absolutely.
we have in
Oh,
America. And
well.
there are some churches in America that just won't have that conversation at all. So
Yeah,
I
we
think
need
this is
major
really good for
translation
us
help
to
here.
hear.
Yeah.
That
You need Janes and you need Sisonkes, because me, there's no priest who's even looking at me and thinking this person is going to speak in a language that I understand. So I think that the power of no, it's true. I think the power of a kind of diverse set of women's voices which bring different things to the table and able to operate in different spaces is actually, critical. I remember when we used to do gender trainings, new South African government had come into being, and we were trying to create this society. We believed that we could create this non-racial, non-sexist society, and that meant doing lots and lots of gender trainings. And it was with public servants. So there I am, a young, 22-year-old young woman, and I'm doing the gender training. And of course, those of you who've worked in these sort of big development institutions know that usually it's like the youngest, least experienced people who do like all the training, which is crazy. So there I am training, older public servants about the new South Africa and the values of, gender equality. And over time, it was a great experience. And over time, I learned some of the tricks and the language that you have to develop to kind of fight the patriarchal discourse. But I used to tease some of the participants in the training because they would say to me, this gender stuff you're talking about is not African, right? This stuff, this is Western. Of course, it's good to have our new constitution, but we mustn't forget who we are, and who we are is Africans. And, over time, I realized that, this is just BS. And we need to confront this. And so I always used to tease these guys and say, so Baba, because that's how you respectfully, refer to a senior, an older man. So Baba, how did you get here this morning? No, I drove. Oh, is that an African car? And that shirt and suits that you're wearing, who made it? Was it not Gucci? Oh, I see, right? So we pick and choose when we're going to be African and when we're going to be Western, what we like from there. And so I think to the same extent that an African man can choose to drive a Volvo and also be a patriarch, I can choose to also take what I like from my African culture. When I got married, we did the lobola ceremony with our family so that my husband can understand where we come from. But we also chose to have my mother there, for her to be the one to speak rather than the men. So you pick and choose. This is a new world, right? And so it doesn't mean that I'm opposed to my African culture to say that I'm a feminist. It means that I have the option. Americans love options, latte this, grande, blah, blah, blah. So I also, as a young African, have the option to choose what I want and what I don't want, that's going to work for my health, for my body, for my rights.
Yeah, beautifully put. It also reminds me that let's not pretend that men are the only problem here, right? Which is something we often do in these conversations. Just because you're a woman doesn't mean you aren't a patriarch or reinforcing patriarchy in some way. And it reminds me of actually a story you were telling yesterday about, you got this critical mass of women in government and some great legislation on the books, but it didn't actually pay off until a more grassroots campaign started. Could you talk a little bit about that?
So when South Africa became independent, one of the first things that women who had been pushing for change for many years, one of the first things that people decided to take on was the issue of abortion. And so one of the first laws that passed was the choice on termination of pregnancy, which is a very progressive law in South Africa, which allows women to have terminations. And part of why it was possible for that to happen so early in our new democracy was because the women on the inside of the African National Congress who had been activists, who suddenly were inside Parliament and literally took over the building. So I remember the stories about having to draw signs to put a women's sign for the toilets because there'd been no women in Parliament in the apartheid regime. So literally, we had to create signs to enable that women, were part of this new institution and this democratic architecture. So there was an elite strategy, a pact that was made between the women who were now in government, who were friendly to women's rights, and the women who stayed on the outside as activists. It was fantastic, but it also meant that years later, as we're trying to implement the law, nurses are not they're not part of the movement, right? So they're conscientious objectors. They're saying, we're a conservative African society, and we're not doing this abortion thing. So you can have all the laws and policies you want, but we're not gonna do this abortion thing. So all the designated facilities are having major problems. Women cannot access abortions in South Africa because the system is resisting. People are refusing because we never brought them along in the first place.
Right. And I wanted to turn to you, Betty, and ask on the subject of sort of the hearts and minds. I think you've been a part of movements that were very visible, right? The marching down Fifth Avenue was very visible. We have beautiful pictures of it. Many of the civil rights strategies were very visible. We were at lunch counters. We were getting hosed at. These things you can see and sort of respond to. Social movements now are not so visible, right? A lot of it is online. A lot of it is much more decentralized and diffuse. We could argue there's so many feminisms. There's the feminism you're talking about. There's many others. So in that kind of climate, do you think it's harder for us to change hearts and minds around women's health because there's nothing physical that people are kind of visceral that people are reacting to?
No, I don't think it's harder. I think that the more of these we have, they're so numerous now. Yes, they are all different, but I think because each strategy deals with a different subset of the population, that we could have an additive effect from the different outlets. So I don't at all think it's harder. In fact, I think in some cases it might be easier because when people saw those marches, whether they were in Atlanta for racism or New York for women, it got a lot of television coverage, it riled up the opposition and all of that. I think the new technology is extremely helpful in building sort of an underground movement quietly, and then it's much more successful because of the element of surprise.
Yeah.
I think we got a much
so
better variety of strategies, better tools.
Yeah.
Well,
we also see it with an example domestically, like the Sandra Fluke situation, where everyone held Rush Limbaugh to task, and basically Rush Limbaugh turned Sandra Fluke into a hero, right, a shero, and now she's running for office. So there are ways in which using that technology has been able to hold the patriarchy and those who are resisting these kind of women's health movements accountable in a way that we never could before, right? Yeah, Jane.
It brings me back to, I'm just thinking about, I'm back home in Kenya now and thinking about what's going on. And we currently have an issue about female genital mutilation. I don't know whether you're familiar with FGMs, but when I first got into this working with women's health, I always thought it was the men who were pushing for female genital mutilation. But I soon realized that actually it was women who were pushing for their daughters to go for female genital mutilation, because they believed that by doing so, they were protecting their girls from being sexually active, and they wanted to preserve their girls for a better marriage. So it was in one of the meetings where we were talking about it, I remember one woman coming to me and saying, Jen, you've talked about the dangers of female genital mutilation, but I want to tell you that if I die, the best thing that you can do for me as your friend is to ensure that all my daughters go through female genital mutilation. it will be a shame for my girls to get married when they have not gone through that rite of passage. So many times we may look at it as the men who are against the women's health, but actually it is us, the women, who sometimes subject our daughters, our nieces, to some of these dangerous reproductive health issues that later on really have bad effects on their life. So I've more and more realized that we need to talk to the women to appreciate issues of reproductive health, issues of family planning, issues of rape, female genital mutilation, so that they can be able to support their fellow women.
I think part of that translation, you know, we were in a breakfast session this morning and someone said, gave this example of, you know, why don't women in such and such part of the world breastfeed? You know, it's so intuitive. Well, actually, Nestle has been pumping and promoting, you know, powdered milk for a very long time, over 50 years. I think that African people don't do things without a reason. No people do things without a reason. So when there's an incentive to do something, it will be done. So the incentive for FGM is the same incentive that women for time immemorial have had, which is to protect their children, right? So if you begin from a place of empathy that says, how do I make sense of this in a way that isn't judgmental, but also isn't coming from the outside, then you begin to figure out what are the strategies for dealing with the need that people have. So there is a real need. The need is to protect girl children from a society that shames them about their sexuality, a society in which there are real consequences for not being cut, yeah? So what is it that we do to replace that, to ensure that we meet the need while keeping people healthy, to ensure that we transform the shame so that if we are getting rid of the FGM, we're also transforming that part of the culture that sees it as okay to mutilate, right? So that's the real conversation that I think is the one that for many years, women's health, people in our area of work have resisted because it's complicated, because it doesn't tick the boxes, and because ultimately it is about power. It moves beyond the technical. They did a training for me, so I'm very good at bringing it back to my points.
Well, I also appreciate that one of the things you're pointing out is there is sort of an Americanized model of change, which is the one bold rebel stands up and says, I will not mutilate my daughter. But that's actually not how change works, right? Yeah. For the most part, there may be a bold early person, but it's really those first adopters who as a group come together and as a community say, we're going to do this. We see this in Molly Melching's work with Tostan, right? And the way that she was able to sort of figure out, it's not about me coming in and empowering that one rebel. It's about having conversations within communities so whole communities can change together. So they have some backup, right? They have some protection to do something very controversial.
But on those controversial issues, it's very difficult to have a sane conversation about any of this without all the emotion and, you know, the overkill. So I think what we can do in terms of if we're looking for something to do, really, is a lot of training in these communities about how we advance these movements in a way that they are less invective and actually become more successful in terms of their productivity and their outcomes.
Which I'm going to turn to you, so be thinking of your questions. It's interesting, we said training, and I think we've talked about training over and over and over again. One of the things in my conversations with foundation leaders that has happened quite often recently is they've said, we're really over trainings. We're really not into funding trainings. So that's another really hard thing is are these trainings being seen as revolutionary as they really can be? They may not happen on a fast scale. They may not be the shiny new technology. They may seem incredibly old school, but they actually, I think we're all saying, are potentially the thing that is going to change the world one conversation at a time, right?
Well, having spent half of my career in foundations is that we want these instant outcomes.
Right.
You know, you give somebody some money and you expect in, 2 weeks they could come back and say, boy, did we ever solve that problem?
Right.
So that's the problem we've got. We gotta educate the people in philanthropy that these patience and long-term investments, because these problems didn't come about overnight. Yeah. They've been, throughout history. And all of a sudden we think we could give somebody, $200,000 and
right. Absolutely.
Yes.
All right, so your questions, your pushback, your comments, and I will say we really appreciate hearing as many voices as possible. That's our goal. So in honor of your fellow conversants, please keep it to a short question or a comment that can really keep a conversation going. I think we've got a couple in the back there.
Somebody over here.
Thank you. I feel guilty for being an African man in many of these discussions. But I'll be a male voice here. And I think it's best illustrated by an example of my personal experience in Washington, D.C. When we were pregnant, my wife and I went for a breastfeeding tutorial at NIH. I was the only man there in a room full of 30 very pregnant women. But there was a data point that I thought was very interesting because they went through latch and grip and flow and all of that sort of thing. The biggest, most significant factor on successful breastfeeding was spousal support. And so where were the men in the room to actually influence successful breastfeeding or become informed on the issue? And I wonder that with the women's movement, there's so much marginalization of men. And how do you actually get men to be part of the solution? Because there are some good guys out there.
Thank you, sir. Well, I have to say, in my experience teaching women's studies classes, guilt is the first stage, and then you move on to realize that your fate is tied up too, and that you have an incentive in feminism to be the most authentic person you can be. So that, I just want to put a plug for, I think, you know, all of us on the stage feel that men have such a stake in women's health. It is not just about being the protector, but it's also about the improvement in their own lives, including, right, your kid's life. If your wife breastfeeds, your kid can potentially be healthier. Sisonke, I'm guessing you have some thoughts on this.
So I work for an organization that works primarily with men and boys to fight for gender equality. And we always insist that we are not a men's organization, because men's organizations have a very bad reputation because they advocate for men's rights. And we advocate for a gender-just world in which men play their part as responsible citizens, as men who are part of loving relationships. And so we run fatherhood clubs all over South Africa. We do lots of work on breastfeeding. We do lots of work on helping men to change nappies. We role model things with them. We took a big South African politician to court because after our president was accused of rape, there was a trial, and so all the defenders of the masculinity then come and speak on television, and one of them made a comment which essentially said that she was raped, she liked it, and now she's sort of crying foul. And so as an organization that works, that is predominantly run by gender-sensitive men and has a very big profile around these issues, we decided that it wasn't up to women's rights organizations to take this issue to court. We sued him in the Equality Court and we won. And we gave the proceeds of that litigation to a battered women's shelter in South Africa. So I'm with you all the way, my brother.
But I also want to say that in the history of social movements, this is what happens. The counter movement comes along, and it looks like it has sort of displaced the whatever we were opposing. But after a time, we get balance, and I think that that's what's going to happen in this movement. The more men, become more understanding of those issues, and the more women are empowered, they're not going to feel the need to always be, marching down Fifth Avenue. That there is some equilibrium that will be reached, but it can't happen now. After all, we just started 30, 40 years ago in America on this matter. So we've got some decades to go. So just be patient. There will be a time when it's all going to,
well, and keep
equalize.
showing up to the meetings. I mean, I think part of what we're talking about here is the difference that it can make culturally when you see someone in your peer group doing something that gives you permission to do it. I know I am actually a nursing mother presently, so I feel really akin to what you're saying. And for my husband, who didn't get very much paternity leave, he's been on a mission now to talk to men about paternity leave, to write about paternity leave, to really sort of legitimize that conversation among his friends who just don't feel like they're even allowed to admit that they want more than 2 weeks, because somehow then they won't be real, dedicated workers. So keep the good fight going. Yeah. Other questions down here? Please wait for the microphone. It'll come.
Hi. I am a mother of one, and I am expecting my second, and I just felt compelled to speak. I am a full-time working mother with a stay-at-home husband, and I live in Los Angeles. We are still one of the minority groups to have that sort of arrangement. My husband took full of California family leave that allows parents of both genders to take up to 12 weeks of half paid and some unpaid leaves. And he was working at the time my son was born, and then he took full leave. And at the end of his leave, he went back to work for 3 weeks, and he decided that he was gonna be a stay-at-home dad. Now, the challenge for me was to, first of all, I come from a very traditional Japanese family. And first, my parents, I knew they were not going to be happy. They envisioned their daughter to have a full-time working husband and for their daughter to stay at home with the kids. So for me, that was a very difficult cultural issue to address with my own family. But it was our decision, and we are still making it work. And for my husband, it's been two years that he's been staying at home full time. And still, he's very proud to be a super dad. But at the same time, I can see that he's not getting a peer support that I thought, of all places in America, LA would give. And recently, I came across a Pew study that came about the emergence of stay-at-home dads and their impact on children. And I'm not sure about the details of the survey or the samples, but it appears that the public supports the idea of stay-at-home dad. At the same time, they admit that the data show that the mother, if mother stayed home, it would be a more positive experience for the children as opposed to fathers staying home. And also, the study also showed that the boys who were raised in that sort of arrangement did not show any difference in perspectives as opposed to girls who envisioned their future partners to have that level of support that their fathers gave. So to me, this is an interesting emergence of phenomenon as we come into this world of gender equality. You talked about women working against women. It appears that we also have the issue of men working against men, and that might be another area of gender equality issue that we need to address today.
Yeah, that's really interesting. Thank you for sharing that. It also makes me think of another thing we had hoped to cover, which is this idea of that we often talked about the second shift, right? That traditionally women who have entered the workforce, which now in the US we are over half of traditional workers, still kept all of their domestic duties, still kept all of the primary parenting, et cetera. And so that is not unrelated to the fact that you see all these autoimmune illnesses, all of these stress-induced illnesses among women. My own mother had an autoimmune illness growing up that emerged from this kind of a phenomenon. And so that is a conversation that we didn't even get to have, which I think is a really important one and transcends cultures. I think most cultures have women dying from stress-related causes. And it's so interesting to see that here's this solution around sharing some of that second shift, and yet there's still all of these cultural factors, even in 2014, that's making someone like your husband feel pretty isolated, and in a pretty liberal place, as you point out. It's not like, you know, you're deep in Texas or something where you might expect there wouldn't be a lot of stay-at-home dads. Well, give him our love and tell him there must be more stay-at-home dads on the internet that he can find. I believe they are there. Other questions,
it's
comments?
Not just cultural, though. It's also economic.
Right.
A lot of companies will not allow this to happen, and so the person has to make a decision: do they want to leave the company entirely, or do they want to?
Right. The structure of the workforce itself is a whole panel we could have. There are a lot of hands, so I want to make sure we get as many people as we can.
Well, there's.
People with microphones, go for it. I'm sort of blinded, so I can't.
Yes,
I can see hands, but I can't really. Okay. There we go.
Great. Thank you to the panelists. This was a really lovely session, and it made me think about the fact that there's another session going on today in Washington, D.C. For the second anniversary of A Promise Renewed, which is the call between the U.S. government, the governments of Ethiopia and India, and 20-plus other countries to end preventable child and maternal deaths. And 2 days ago, when I was looking at the last version of the draft agenda I had, there was only one female speaker for the whole day. And so I mentioned that to my colleagues who were working on the event and said, how are we still having events like this about maternal health in this day? And so with all four of you, amazing women working in this field, I just wanted to ask what you think about this type of leadership and sort of the difference between getting men involved in health, but also sort of being just the face and being the only leaders who are available to talk. So thank you again.
Great question. Horrifying, though not surprising anecdote, right? We're all like, yeah, of course. The most successful thing I have seen around this, part of this is personal power, right? How do we get more women to say yes when they're asked to speak? How do we get more women to own and name their expertise? There's an organization called the Op-Ed Project that I've been connected to that's very successful at doing this. But also, some of the most interesting work I've seen around this particular issue of kind of the share of voice and women is around men as allies, men who say, I will not be on a panel where there aren't as many women as men. And this goes for racial composition too. I have a policy now that I will not be on panels of only white panelists, and I will not just say no, but suggest a million other people, right? So men can do that too. Men can personally pledge that they will not be a part of conversations, and not just about infant mortality, mind you. I don't think they should be conversations about technology or about the economy or about all of these supposedly male issues without women on those panels. So we behoove all of you great men who came today to do that. Take that personal pledge and tell your friends about it and spread it that way, because sometimes it's about those networks and who's on the phone, who picks up at what time, and the capacity for all of us to leverage that moment to make sure that these conversations are more diverse in the most genuine, way that word could be used.
I just said one thing. I'm glad you said it in that way, because in the African American community, there is this concern that the women's issues in America have now taken precedence as we talk about disparities and inequalities, have taken precedence over African American issues. So we've got to figure out a way where we got this big tent, and that we are a big enough country and there are sufficient issues where we can certainly have a rainbow of representation, because that's the country it is. Right. It's Asian, it's Indian, and so on. So women ought not to be bearing the brunt of that criticism. Absolutely. And that's the problem.
Let's get a couple more. I think we have time
right
for
here. Oh, she has her hand up all morning. She's had her hand up.
Good afternoon. Oh, okay, Peggy, go on.
We have to get Peggy a microphone first.
Peggy needs a microphone.
The title of this session is The Unfinished Revolution, Women's Health. And I'm 58 years old. I'm pushing 60. I was a part of the first feminist organization in any high school in America. I've been working most of my life on women's health issues. We're approaching a time when Hillary Clinton is about to run for president, and once again, we're going to go through all these gyrations about how her hair looks. There's 200 girls that are still missing somewhere in Nigeria. Why is this revolution still unfinished? Why are we unable to make more progress on women's health? I'd really be interested in your thoughts.
That's the big question. I remember in 2003, I got a call and I was told that the Secretary General of the United Nations, who was then Kofi Annan, wants to put together a task force on women, girls, and HIV. Why is this happening to women in such large numbers, right? And so I was very honored, and so off we went all across Southern Africa, talking to different people about why, in disproportionate numbers, women were getting infected with HIV. And so we put together this wonderful report, and it was beautiful, and it was printed, and it was distributed throughout the world. And essentially what we said in that report is what women's rights activists had been saying for years, which was that so long as women and men are not equal in relationships, women will continue to have more HIV than men because it's hard for them to say no, right? It was not rocket science, it was not complicated, and somehow we thought that telling the United Nations this would make some real tangible difference. And then I started to work for the UN so that I could make sure that the recommendations were implemented, right? I'm really committed to this thing. And so I'm gonna join the system and I'm gonna help to make sure that this thing, that we are gonna deal with this, right? And of course a report is a technical solution. And one of the technical things that we said was that in all national strategic plans on HIV across Southern Africa, we saw beginnings of an impact of our report. We saw that women were suddenly showing up in the national strategic plans. But guess what? They were stopping at the end of the introduction. There was no money. There was no costed plans which involved budget lines for what we were going to do about that. What education programs was that going to, what family planning, what did that actually mean? And so therefore, 5 years later when we're monitoring it, all we've got is a lovely rhetorical contribution at the beginning. So the reason that the business is unfinished is because we have fought so much on the rhetorical level, and yet we haven't always followed up with the boring, mundane, bureaucratic detail of where the power really lies, which is getting that into the budgets and into the systems so that we deliver on women's health.
Amen.
I just want to feed on what Courtney raised about around training and just share a little bit of experience I had when I started working in HIV prevention work in Nigeria. When MDGS started and there was so much training on women, contraception, and I think we spent over 10 years training women on how to negotiate safer sex. And I think at the monitoring and evaluation of that, we realized that we're never going to win the war unless we involve men. And then there was a complete shift on actually not just taking men to the maternity ward, but actually sitting men down to let men understand how useful it is for a woman to have a contraception and how they should actually support not just their wives, but their daughters as well to be able to have contraception. And I think the shift in the daughter language changed the whole thing completely because the woman belongs to someone else. It's another person's daughter, but this is my daughter. I need to protect my daughter. And immediately there was a huge shift in the discourse around contraception. So in as much as I want to provide for my daughter, I need to take care of my wife as well. I don't feel guilty as a man for what has happened, but I also think that putting the burden of training on women is becoming too much. And part of getting to that revolution is actually seeing what role will a man play in contraception campaign. Until we get to that and know that it's not just about him wearing a condom, but about him also understanding that a woman needs to protect herself as well, then maybe the conversation will change.
Thank you.
May I just say that coming from a man, it has a lot more power. So it would be great if that could be repeated in lots of other audiences. I think you're
and it's
on the
also
right track.
the third shift, right? We talked about the second shift. The first shift is your real job. The second shift is taking care of your community, your family, et cetera. The third job is the revolution, right? So no wonder we're all effing tired because it's our third job. That's part of why it's unfinished. It's because people don't have enough bandwidth, right? So for men to join us in those settings and take some of that third shift and be a part of the revolution has huge potential. And I think it's happening more and more. There are a lot of incredible organizations and individuals who are working on that level. So thank you very much for that. I think we probably have to wrap up, am I right? I want to thank these panelists because I think it's been a really complex, interesting conversation, thanks to them. And thank you for being here.